Are you being forgetful? Do you have memory problems? You're worried that you have dementia. The question is that could it be something else that is mimicking dementia? And the answer is yes. Today we're going to be talking about pseudodementia. With pseudodementia, the illness mimics the symptoms of dementia, but it's completely different, with different pathophysiology, different diagnosis, and different treatment. So it is important to differentiate between the two. Now, how do we differentiate between the two as a physician or as a patient? Although it could be difficult, but there are certain things that we look at that can help us differentiate between the two. We begin with the symptoms of pseudodementia. It starts with memory problems, concentration problem, attention problem. Then they have mood problems, including depression, social withdrawal, the sleep disturbances that could be excessive sleepiness or insomnia. They have also loss of appetite. Now, with also dementia, the patient typically do not realize and recognize a problem. So they're not going to complain to their family or their physician about their problem. With pseudodementia, typically the patient will recognize that they have a problem and they might bring it to the attention of their family or their physician. Also, we look at the age. Although both diagnoses are always in the back mind of the physician, but if the patient is young, we think more of pseudodementia. If the patient is older than 65, we think more of dementia. Now, the physician will order blood tests, including checking for B12, thyroid panel, and vitamin D, and other tests. And if they have a problem, they treat it. Now, on the MRI, we order an MRI of the brain for both. And for patients with dementia, although non-specific, but there are certain signs that we see on the MRI that can help us go toward dementia, versus the MRI of the brain of pseudodementia patients should be normal. Now, even at times, it could be very difficult to differentiate between the two, and the neurologist will ask for the help of psychiatrists or neuropsychologists to run a battery of neuropsychologic testing to help them differentiate between the two. But at the end, it is important to differentiate between the two because the treatment is different. So if we diagnose the patient with pseudodementia, we treat the problem and therefore the memory will improve. So if they have depression, we treat depression and the memory will improve in its own. If they have thyroid problem or problem with B12, we treat it and therefore the memory will improve on its own. However, with dementia patients, we use the medication specifically for the dementia, and typically we do not see immediate results or a quick results with the memory. But at the end, it is important to differentiate between the two because the treatment is different. And what makes it even more difficult, and at times patients with dementia can have depression or can have thyroid problem or B12 problem, and that's when it gets even more difficult to treat. But it is important to diagnose all of it, so we treat everything independently. Thank you.